Hello everyone and welcome to the Medic Mentor's February study guide. So I'm Sherry-Ann, I'm the VP Veterinary here at Medic Mentor. We're going to start off with the veterinary stream today, and then Sharon's going to do the dental stream for us, and then we're going to move on to the medical stream on Thursday night now at 8 o'clock. Okay, so this month, sorry about that, just lost you there for a minute. This month's problem-based learning was about different causes of abortion and pregnancy care in people, alongside with abortion and toxoplasmosis in sort of sheep and cats on the veterinary side of things. Okay, so the first veterinary question was, what can you find out about the life cycle of Toxoplasmosis gondii? So there's two hosts in the life cycle of Toxoplasma. The cat is the definitive host. This is where the Toxoplasma can reproduce. Okay, so this is where they can produce their oocysts, which then sporulise. These sporulated oocysts are infective and they can remain sort of in the environment for quite a few months. These usually go into an intermediate host. So these can be lots of different mammals, really. So there's people, farm animals like sheep and goats, okay, sometimes pigs and chickens. Now, when these oocysts are ingested, as the oocysts are digested, they can cause some symptoms or they cannot. So if a pregnant woman ingests some of the oocysts, she can have an abortion herself. She may also just get a little bit ill, like Kathy did in this situation. So this life cycle then gets back to the cat when the cat eats what's called bradyzoites. Now, this is where the oocysts develop into in the meat. Okay, so this is usually when the intermediate host has been a farm animal, and the cat eats some sort of meat material. So this could be some meat that they've been fed, or it could be sort of if they found a dead animal. Occasionally it can go into sort of some rats, and obviously that is a natural food source for a cat. So when the cat then ingests that material, they can produce more oocysts and the cycle goes round again. Okay. So the next question was, based on this, how is Sarah likely to have caught toxoplasmosis? So firstly, I made a bit of a mistake here. I got the two characters muddled up, and of course it was Kathy that caught toxoplasmosis. So in this case, she didn't come into contact with the outdoors, really, so she probably caught the toxoplasmosis from emptying Monty's litter tray. Okay, so this then causes ingestion, so it could be that she didn't quite wash her hands properly, or some other method of that getting inside her body, which then could have passed to her baby transplacentally. Okay, so when people first get pregnant, they can quite often come to you as a vet and think that they need to give up their cat. Okay, so information around is getting a lot better now. It's not as common as it used to be, but in general, the risk of toxoplasmosis is usually quite low, especially because cats only shed oocysts if they've got a new infection. So that means that there has to have been a cat that has not been infected before that then so we would call that a naive cat, that then gets sort of ingests some of these bradyzoites and then begins to shed oocysts themselves. So this doesn't happen much of the time. As a cat gets older, it starts to build up some immunity, so it doesn't happen. And then there's some sensible precautions that they can take instead. So it'd be recommended that a pregnant woman wouldn't empty the cat's litter tray, wouldn't eat raw meat, which obviously is sort of not really done anyway nowadays, but it's even more important when someone is pregnant. So if they're on their own, they could use gloves for the litter tray, but usually there's someone else in the household that can do that for them, do that sort of chore for them for a little while. Okay. Other hygiene precautions are sort of just basic hygiene, really. So making sure you're washing your hands really well, washing vegetables before cooking, because some soil can get contaminated with oocysts as well. Okay, and wearing gloves while you're gardening. So again, for oocysts in the soil. Some people also recommend to get a covered litter tray for their cat. So this is one with a bit of a roof as well. Just helps stop oocysts getting out of just the litter tray area. So we moved on to asking how we treat toxoplasmosis in cats. So this is usually sort of long-term antibiotics, usually one called clindamycin, or occasionally one called TMPS. Okay, now treatment can last from between 4 weeks or definitely at least 2 weeks after the clinical signs we're seeing are resolved. So clinical signs for toxoplasmosis in cats are really quite widespread varieties. There can be some gastrointestinal upsets, there can be some neurological issues, and sometimes if they have gastrointestinal upsets, you may need to give them supportive care as well as the antibiotics to make sure that they're maintaining adequate hydration and their nutrition is remaining well. Okay. And some cats will also get a bit of uveitis, so inflammation in the eye, and some eye drops can work really well. Topical glucocorticoids would be used in that case. We also asked how we can treat toxoplasmosis in sheep. Now, that was a little bit of a trick question because there's not really much treatment you can do. It really involves making sure that we've sort of trying to prevent it happening in the first place. It's much more of a preventive treatment than a treatment after anything's occurred. Okay, so quite often it can be contaminated feed or something like that, and that's not going to be, by the time you're seeing the signs and realising that you've got toxoplasmosis, it's usually a bit late to prevent that again. Okay, so there is a really good vaccination available, and they can vaccinate between 3 weeks and 4 months before you make the sheep, to provide some immunity. So the ewes will also develop some immunity if they get a new infection. So the first year a farm catches toxoplasmosis, they'll probably lose a lot of lambs. But after that, the older sheep will start developing some immunity, and any future infections are probably going to be a bit less severe. Okay. So then we asked about any other causes of abortion storms in sheep, and if any of them are zoonotic. Okay, so there's quite a lot you could have found here. So some of them are more common and some of them are less common, but there's Vibrio, which is caused by Campylobacter bacteria, which are zoonotic. There's enzootic abortion, caused by chlamydia bacteria, and these are also zoonotic. There's one called border disease, which is a virus, a pestivirus if you want to be exact, but that can't pass to people. There's listeriosis, brucellosis, and salmonella. So there's varying sort of degrees of how often we'd see a lot of these things. We don't really see much brucellosis, but obviously there's a lot of salmonella around. Another one is blue tongue. That's notifiable in the UK, which means you've got to notify the government if you diagnose or suspect blue tongue. So it's really quite a nasty disease, but luckily we don't see it very often. Okay, so depending on what you were looking at, you may have also found that some toxin ingestions can cause abortion. Haven't included them because I was thinking more sort of contagious disease when I wrote the question, but I didn't word that particularly well. You may have also found something about Cache Valley virus. So you might get that if you've done a Google search, but it's actually sort of quite localized to the America area, so in the USA, in Mexico, in Canada type areas, and not so much relevant to us here in the UK. Okay, so that was all the veterinary questions. Dr. Ruppel's going to be up next with her dental stream. Okay, we'll just be back in a few minutes when we just need to swap over the login. Okay, thank you.